Hi, I'm Scott Harms. I'm a physical therapist with Performance Therapies. I'm here to talk today a little bit about the spring seasons and rotational athletes. As the spring season is upon us, athletes are going to be taking the field playing baseball, softball, golf, and tennis. A lot of times with those rotational athletes, we start to see low back pain. As a physical therapist with Performance Therapies, I'm here today to kind of give you some guidance on how to work on and prevent that low back pain and hopefully prevent back pain from getting worse as the season goes on. The lumbar spine, or the low back, is made up of 5 vertebrae. Each vertebrae has a little disc that sits between the vertebrae above and below it, and that disc is meant to withstand rotational stress, withstand forward and back stress and side to side stress. However, those discs over time, if are stressed too much, will start breaking down. So the lumbar spine is also a very vulnerable region of our body. It sits between a big rib cage and a big pelvic girdle, and it's a little pillar that needs to transfer energy between those two forces. In a rotational sport, our goal is to put pressure into the ground and take the ground reaction force, or the pressure the ground pushes back on us, and transfer it into a rotational movement. The lumbar spine needs to be a nice stable region to allow weight shift or energy transfer between the lower body and the upper body. Ideally, the lumbar spine moves minimally, and we create that rotational movement through our hips and through our upper back. If we lose motion in our hips or lose motion in our upper back, the lumbar spine is going to start to twist and rotate too much. Those discs that we talked about are going to take a little too much stress. The joints in the lumbar spine are going to get compressed a little bit more. Whereas if we can keep that lumbar spine pretty stable, create the rotation at our hips and at our upper back, and use our big muscles of our hip to create that rotation and develop the force, and just transfer that energy from the hips through the back into our upper body and into the golf club or the racket. That'll help protect that lumbar spine. As you get back out there on the playing field or on the golf course or on the tennis court, if you start feeling that low back pain, just starting to feel a little sore, maybe not even during your activity, maybe after your activity, don't wait until that soreness becomes a little too much to limit your activity. Come see us before that pain becomes a bigger issue, before that back starts to break down even more. If we can take care of the small issues of maybe some hip mobility or upper back mobility, or just allowing that energy transfer before it becomes a bigger issue, we'll have a much better success rate.